Hello guys, you're welcome to my channel, and today we are continuing our series. The last time we spoke about how to prevent malaria. We've also spoken about personal and environmental hygiene. The third topic that we are going to talk about is nutrition, and we are still going with how NMC wants us to do when we are educating our clients so that we get our full marks, and also after our exams we can give quality education to our clients and tell them things that are relevant and not just talking. So today we are continuing, and I want you to pay more than the usual attention. It's so easy to assume that nutrition is simple, I'll nail it, but when we finish you would understand why certain things need to be mentioned to get your mark, or to ensure that you are able to reach the patient's heart. So why do we need to talk about nutrition? Is it not simple? If it is simple, or if it is not necessary we talk about nutrition, then we won't have the statistics. The statistics here tells us that there is a lot of work to do. So globally, 31% of women of childbearing age are anemic. When we say childbearing age, we are talking about the ages between 15 and 49 years. 31% of these women are anemic. In some African countries, sometimes it's about 50% of the women of childbearing age who are anemic. Ghana has reported an anemic level of 35.4% among women of reproductive age. So it means that 1 in every 3 women in Ghana is anemic. Apart from the anemia, there's another aspect of nutrition that is also emerging, and that is obesity. So according to the Global Nutrition Report, obesity among women 18 years and above in Ghana is 19.5. Almost 20% of our women are obese. So this means that these women will start pregnancy with a deficiency in their nutrition, which needs to be addressed. So over 35% will start with anemia, and almost 20% will start with obesity. Apart from that, there is an increase in non-communicable diseases like diabetes and hypertension, and a key way to manage these conditions is by nutrition. So it tends to reason that as health professionals, nurses and midwives, we have a lot of work to do in the nutrition aspect. Now, the most common type of anemia that we experience in Ghana, in most African countries, is the iron deficiency anemia. That is the anemia that is caused by low iron intake. So as we educate the women, we will be incorporating all this into it. So example of food rich in iron. Remember we said that most of the anemia are because of reduced iron intake. And so these are some of the examples of food rich in iron. I think we should pay attention, because sometimes we just focus on one aspect. Now this is liver, this is broccoli, this is a bean, a type of beans. We have dried mushroom here, we have green leafy vegetables, fruits, and so eggs. All these are food rich in iron. So knowing a variety of food rich in iron would enrich what we tell our women, so that we don't focus on just one particular food. What if the person does not like that food that you are encouraging her to eat in order to get iron? Now, the focus is on nutritionally adequate diet. First, we used to say balanced diet, balanced diet, balanced diet. We have moved away from balanced diets a little bit, in a way, nutritionally adequate diet. So you look at the person you are talking to, the individuality of a man, and recommend a diet. So for instance, if you are dealing with an obese woman, you won't go saying, oh, it's a carbohydrate and protein and in a certain proportion. You would know that this woman needs more vegetables and protein. and reduce carbohydrate intake. So you look at the individual and make a decision on what is nutritionally adequate for that person. So there is no wholesale diet recommendation that everybody must follow. It is what is adequate for that person in particular. So bear in mind. So I brought this slide here to draw attention to something very popular, especially here in Ghana, Jacky berry or Kweunsusa or Samantraba. That's what we call it. So this Jacky berry is a plant that is so common around, and it is used to treat or manage anemia. And so among the accounts, it is something that we use liberally. But people from other tribes and ethnic groups might not necessarily like it. It's not part of what they grew with. They don't like the taste. So as midwives, we should refrain from focusing our education based on this vegetable alone or this plant. It is true that it is rich in iron, but we should also remember that not everybody likes the taste. Not everybody can tolerate it. Also, there are other plants that are equally effective as this vegetable. So we can mention it, but let's not focus all our education on this. Otherwise, if the patient is not somebody who can tolerate it, who does not like the taste, this patient will miss out on getting to know other alternatives that she can fall on to improve on her iron intake. Not to say that berry is not good, it's a very good plant. However, we should learn about other alternatives so that when we meet clients who don't know how to use this, who don't like it, they can benefit from knowing about alternatives that they can, rely on to improve their iron intake. Now, we are going to the main issue or topic. How do you give this education? After you have done your rapport, privacy, ensuring that the patient is comfortable, you ask about the woman's eating habits. As I said in previous series, don't assume that the woman does not know anything, and also don't assume that it is you that you are going to tell her everything. Make your work easy by asking questions. So you ask her eating habits. Based on what she say, then you know what to add on. Then you ask about local food that are available to her. If it's a farming community, you can focus on the food that is grown around, If it's not a farming community, it's an urban community, you ask her what she buys or what she has in her storeroom, That is what is available to her. And also ask about food taboos and allergies. There are certain people who culturally they don't like a certain food. Others too are allergic to it. So you ask about it so that you don't go about encouraging her to take something because you don't know she's allergic to it. Or you don't know she has a taboo. Okay, if you are finding it difficult to ask about her food habit or her eating habit, you can just tell her to give you to tell you what she ate over 24 hours or 48 hours, and that will give you an idea of what runs through for you to know what to educate her about. Now, after you have asked all these questions, you know her allergies, you know her taboos, you know the food that is available to her, then you talk about how important it is for her to take nutritionally adequate diet or balanced diet. To make it easier for you, you can just pick the new maternal record card book. There's a particular page that has this 4-star diet recommendation. There you see all the classes of food grouped into 4 boxes. And then based on what you know about it, you can talk about each of the boxes. And by the time you finish talking about all the boxes, you would have talking about the main classes of food. Then you use it to educate her. Now talk about the importance of roughage and adequate fluid intake. You know that a woman must take 8 to 10 glasses of water at least a day, and then she must take roughages. In my experience as an examiner, you realize that all the students are talking about the roughages in oranges, but there are several things that the woman can take to give her fiber and roughage. So what if the woman does not like oranges? Then what will she do? The next slide will talk about other things that you can tell her to take to ensure that she has enough of it to prevent constipation. Now, tell the woman to avoid taking any non-nutritious substances. What are we talking about? Talking about the pikers, talking about caffeinated drinks, we are talking about alcohol, anything that does not offer any form of nutrition, she should avoid it. And encourage the woman to take iron supplements and folic acid and vitamin C, because you need vitamin C to produce the blood. The vitamin C must play a role in making sure that the blood is produced. So encourage her to take her iron supplements, her folic acid, and the vitamin C, and tell her to report any severe vomiting, because of course when she's vomiting, it means she's not retaining anything. It means that she cannot benefit from whatever she's eating, so it should be addressed. So after you've said this, then you go ahead and conclude, asking her to ask questions, thanking her, recording all those things that you need to do at the end of the the, the discussion. So these are examples of some rough edges. You see cabbages, you see apples, you see strawberry, you see coconut, pawpaw, banana, oats. All these are examples of things that she can take to get roughage from. So let's move away from just the orange. If she likes orange, fine. But if she doesn't, she has options. And some of them are seen here. Then the fluid intake. Always remember that one sachet of water is between 450 ml and 500 ml. And an average glass of water is between 200 and 250 ml. And what she's required to take is a minimum of 8 to 10 glasses a day. So with this, you know what you are telling her. Don't go and tell her to take 10 sachets of water because you think one sachet is 200 ml or so. Just have this in mind as you educate her on fluid intake. So in conclusion, every type of meal across Ghana, across Africa can be healthy, can be nutritious, depending on how you combine your ingredients. So learn what the woman likes and help her to combine the ingredients to make her food nutritious. Don't be fixated on one particular ethnic group's diet. Be versatile, move around, and see that every food can be nutritious for the woman. So thank you for watching. I want you to subscribe if you have not. I want you to share so that your friends can benefit and also like. So I'm hoping to continue this series very soon with more topics for you to to learn from as you prepare for your exams and beyond. Thank you. Bye.